You want to show the camera the picture there?
I've lost 122 pounds in 10 months.
Yeah. Can we ask, I mean, do you feel comfortable? Can I ask your starting weight?
You can ask me anything. I was 272 pounds. 150 today.
Wow, that's wonderful.
That was my original.
Now, what about, how was your surgery? How did it go?
Same as everybody else's. It went very well. I was nauseous for a couple days afterwards. Got some prescriptions for that. I was fine. 3 days after surgery, my mother and I went to a Beyonce concert, and we walked the Strip, and it's been the most amazing experience ever, and I owe my life to you. I said to my mom, I said, I think when I see you, I'm going to like cry. Yeah. Just everything about my life has changed.
Really?
Since that day. Yeah. I suffered from severe depression for 10 years, and I haven't even come close to being depressed since.
Really?
Yeah, I suffered from severe headaches for 3 years before the surgery.
Right.
Since the day of surgery, I haven't had anything close to what I was experiencing.
Now you guys know I paid her. She's an actress from downtown.
No.
That's pretty wild, huh?
Yeah.
Let me talk about depression for a second. Is that okay?
Of course.
Some kinds of depression we don't think get better after the surgery. There's a kind of depression called clinical depression or non-situational depression, and when you get over your surgery, a lot of good things happen. You lose weight, and maybe your diabetes goes away, your high blood pressure, and things like that. But if you have an underlying chemical depression, sometimes that won't get better. But if you have what's called situational depression, let's suppose you're depressed because of the situation you're in. You can't walk upstairs. You can't get down and play on the floor with the grandkids. You can't go on an airline without the extra extender. Those situations can make you depressed. And if those get reversed, then sometimes we do see depression get better. So it's kind of exciting to see you feeling so well.
Yes.
Yeah. Now, what about the headaches? Can I explain those to you? Do you understand? Does everybody understand? Or can I explain? Is anybody interested in why your headaches should get better after the surgery?
Yeah.
Remember all the fluid that people were losing here? 10 pounds, 20 pounds, 120 pounds. A lot of that is salt water that comes out. If it comes out of your ankles, you wouldn't be surprised if your ankles thinned out. If it came out of your lungs, you might not be surprised if you could breathe easier. If it came out of your joints, imagine we drew fluid out of your joints. It might not be surprising to realize that your joints hurt less. It turns out the skull is floating in a little bit of fluid called the central spinal fluid, cerebrospinal fluid. And if we measure it in a heavy person, the pressure in there is elevated, and it can hurt. And after surgery, the intracranial pressure measured in heavy people goes down. And so we think that many of our patients get better and their headaches go away because of a decrease in intracranial pressure.
I remember that pressure. I used to feel it all the time in the back of the head. Yeah.
Cool. So
Yeah.
we hope and pray and expect other patients will have that same benefit.
Yeah.
Well, you look wonderful.
I feel wonderful.
Any questions?
Oh, that's wonderful.
Yeah.
Just to let you all know, at about a month out, I thought that I made the biggest mistake. What did I do to myself?
Right.
You know. But a couple months after that, I got used to everything. You know.
Why did you think that after a month?
Eating. I missed food. I just wanted a hamburger. That's all I kept saying to my mom. I just want a hamburger. And I went to go get the patch, and I thought it was covered, and it wasn't. I didn't bring my money with me, and I went home, and I put it off. A week later, I was fine. I didn't need it.
Okay.
Yeah. And that was about a month out.
Yeah, we have one of our patients. I think she's listening today. She said she had buyer's remorse. She got home with the MGB and goes, boy, how did I get into this?
Yeah, yeah.
Is that right, Marianne?
My sister-in-law also had the surgery, Cindy, in January. So she's doing very well, too.
Oh, good.
She's...
Hope you'll tell her I said hey.
Yes, I will.
Good.
Yeah.
How long was your bypass?
7 feet, I believe. 7 feet, yeah. 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 Awesome. Awesome. Best thing I ever did.